Well, as part of the Affordable Care Act, states can come up with their own health care options, and Colorado is putting to a vote a controversial choice, a single-payer system like those in many foreign countries. Bertha Coombs has details on Amendment 69.
Big deep breath here.
Dr. Ben Vernon thinks the Affordable Care Act is like a Band-Aid on healthcare's gaping wound.
I don't see how the present system has the economics that can support prevention. We haven't figured out if we save $500,000 from a patient having a heart attack, who has that $500,000?
The Denver surgeon is an advocate of Colorado's Amendment 69, which would create the first in the nation single-payer health system, Colorado Care.
When there's one payment authority looking at all of what's happening across the board, we're going to have a much better handle on our providers' quality.
Amendment 69 would fund Colorado Care with a 10% state income tax, with employers paying 2/3 of that tax. Business groups say it would hurt competition here.
Being the only state in the union who would have a system like this makes it very hard for Colorado to compete economically. We'd have the largest income tax and payroll tax in the country, and it hits our smallest businesses the hardest.
The measure made it onto the ballot after advocates raised the money for a signature drive, but Colorado politicians of both parties are also opposed, worried about long-term funding. A Colorado Health Institute study found Colorado Care would break even its first year, but soon rack up deficits without tax increases. Supporters like Irene Aguilar argue that study underestimates the impact of savings.
I think what's important for consumers and everyday voters to look at is how does this compare to what we're doing right now? And overall, that's win-win, even in their assumption.
Even if Amendment 69 fails, Colorado Care advocates say they think they're on the right track, because with the impasse over the Affordable Care Act in Washington, the answer to fixing the problems with health care costs has to come from the states and the local level. Bertha Coombs, Nightly Business Report, Denver, Colorado.